The common cold, the annoying roommate you can't kick out. The common cold is exactly what it sounds like. Common. Everyone gets it. Caused by a virus, usually rhinovirus, it enters through your nose or throat. Within a couple of days, you're sneezing, coughing, and feeling like someone stuffed cotton into your head. It's not dangerous for most people, but it's incredibly annoying. The worst part? There's no magic pill. Antibiotics don't work because it's a virus, not bacteria. All you can do is rest, drink fluids, and build a tissue mountain on your nightstand. So, think of the cold as that freeloading roommate who shows up uninvited, eats your snacks, and leaves a mess, except the mess is congestion and a sore throat. The flu, the cold's meaner, stronger sibling. If a cold is just a small annoyance, the flu is like getting knocked flat on your back. It's also caused by a virus, but it's much tougher. With the flu, you don't just sniffle, you get a high fever, chills, sore muscles, coughing, and you feel so drained it's like a truck ran over you, backed up and did it again. The flu can actually be risky, especially for kids, older people, or anyone with a weak immune system. The good news, there's a flu shot that helps protect you. So if you skip it and end up stuck in bed for a week, well, that's kind of your choice. Basically, the flu is like the cold's bigger, meaner sibling who works out and picks on you just because it can. Diabetes, when sugar refuses to behave. Here's the deal. Your body needs sugar for energy, but it needs insulin to move that sugar from your blood into your cells. Diabetes is what happens when that system stops working. Type 1. Your body just doesn't make insulin anymore. Type 2. Your body makes insulin but ignores it like a teenager ignoring chores. Without insulin doing its job, sugar builds up in your blood. That messes with your nerves, kidneys, eyes, heart, basically every system. It's like leaving soda in your car engine. Doesn't end well. Treatment. Diet, exercise, sometimes medication or insulin injections. Translation: your body is on sugar probation and donuts are now classified as contraband. Hypertension, the silent killer. High blood pressure sounds boring, but it's deadly. It's when your blood is flowing with too much force through your arteries, wearing them down over time. The scary part? You don't feel it. No obvious symptoms. That's why they call it the silent killer. You only find out after it's caused heart disease, a stroke, or kidney damage. Imagine blasting your house pipes with full pressure 24/7. Eventually something bursts. That's hypertension in your body. How do you fix it? Less salt, less stress, more moving your body, and maybe stop pretending 5 cups of coffee counts as hydration. Heart disease, the traffic jam of life. Your heart is basically a pump that sends blood everywhere, but over time, arteries can clog with cholesterol, fat, and other junk. That's heart disease. It shows up as chest pain, shortness of breath, or in the worst case, a heart attack. It's the #1 killer worldwide, not because it's unstoppable, but because modern life is basically designed to cause it. Fast food, sitting too much, constant stress. Think of it like traffic. If the highway is blocked with accidents and slowdowns, nothing moves. Same thing in your arteries, only instead of late to work, your heart just stops. Obesity, extra storage, wrong location. Obesity isn't just about looks. It's about health. It means carrying way more fat than your body can handle safely. That extra fat puts stress on your heart, joints, and organs, increasing your risk of almost everything. Diabetes, heart disease, even some cancers. The tricky part? It usually builds up slowly, over years, thanks to modern diets and lifestyles. Fast food, long hours sitting, and "I'll work out tomorrow" add up. Think of it like having a storage unit filled with junk you don't need. Except instead of old furniture, your body is carrying around health problems that charge rent every day. Depression, when the brain hits low power mode. Depression isn't just feeling sad. It's a medical condition where your brain gets stuck in low gear. You lose interest in things you used to enjoy. You feel drained, hopeless, and even basic tasks feel like climbing a mountain. People with depression can't just snap out of it. Telling them to cheer up is like telling someone with a broken leg to just walk it off. It doesn't work that way. The good news? Treatment does exist. Therapy, medication, or both. And talking about it is important because mental health is health, period. Cancer, the body's betrayal. Cancer is when your cells stop following the rules. Normal cells grow, divide, and die when they're supposed to. Cancer cells, they go rogue. They divide non-stop, refuse to die, and spread like rebels, forming their own empire inside your body. Different cancers affect different organs, but the idea is the same. It's your own body turning against itself. Treatments include surgery, chemo, and radiation, basically declaring war on the rebel cells. It's terrifying, but the earlier it's caught, the better the chances. So yeah, go to your checkups. Don't skip them. Pneumonia, the chest invader. Pneumonia is when your lungs get infected and fill with gunk, fluid, mucus, all that fun stuff. Breathing feels heavy, like trying to suck air through a wet sponge. Symptoms: cough, fever, chest pain, and feeling like you just aged 40 years overnight. It can be mild for some people, but for others, especially the very young, old, or weak, it's dangerous. The good news is doctors can treat it with antibiotics if it's bacterial, or just supportive care if it's viral. Either way, it's your lungs saying, "We are closed for business, come back later." Stroke. The brain traffic jam. A stroke is basically a brain emergency. It happens when blood flow to part of the brain is blocked, like a clot clogging the pipe, or when a blood vessel bursts. Since the brain controls everything, speech, movement, memory, the damage can be instant and serious. Signs: sudden weakness or numbness on one side of the body, slurred speech, confusion, or trouble seeing. Doctors use the FAST rule: face drooping, arm weakness, speech trouble, time to call help. The scary part is every minute counts. The longer the brain goes without blood, the worse the damage. Think of it like your brain's Wi-Fi getting unplugged. If you don't plug it back in quickly, the data gets corrupted. Alzheimer's disease, memory on shuffle mode. Alzheimer's is a disease where the brain slowly starts deleting files, memories, thinking skills, even basic abilities. At first, it may look like normal forgetfulness, losing keys, forgetting names, but over time it gets worse. People forget places, loved ones, even how to do everyday tasks. It mostly affects older adults, and while we don't know how to cure it yet, there are ways to slow it down and help people live better with it. Imagine your brain as a giant library. Alzheimer's is like a mischievous librarian going around ripping out pages and putting books back in the wrong places. Slowly, things get more confusing until you can't find anything at all. Diarrhea, the toilet speedrun. Diarrhea is when your stomach throws a full-blown rebellion and says, "Everything must go, right now." Instead of your food calmly digesting, it's like your gut hit the fast-forward button. One wrong meal or nasty bug, and suddenly the bathroom becomes your second home. Your body's basically yelling, "Cancel your plans, grab some toilet paper, and stay hydrated because this roller coaster doesn't stop." It usually passes in a few days, but while it's happening, it feels less like a health problem and more like your digestive system signed you up for an unwanted bathroom boot camp.